Thank you very much. I think the only area that I will respond to is probably the cost of the exams, because I think that comes up regularly.
Today.
Again today. Yeah, as a matter of fact, it's a little more complicated. Number one, we have 4 separate exams, as I mentioned. We have 400 items on each exam. We also do adaptive testing. And I went over today the reasons why we're doing adaptive testing: security, year-round testing for applicants, and more reliable measure. So for those 3 major reasons we do that. It is more costly. I mentioned in my testimony, I didn't bring it up in the oral testimony, but it's in the written testimony, that when you're doing adaptive testing, you have to have a much, much larger bank of items, because you're tailoring each exam to the candidate, because you're tailoring it to their ability, not what the average ability is. Won't go into all the rigor of adaptive testing and all that model, but it's been researched for many, many years, and it's a very, very valid model. So it has more cost. But related to the cost, when NCSAM decided to go from written exams to computer-based exams, it did not, when it had the modules, it did them written for 1 year. We went to computer-based testing. We contracted with Pearson VUE. We switched to a psychometric firm that can do adaptive testing in the following year in 2007, and we did not raise the exam fees. We have not raised exam fees since 2000, I think the last time, well, it was before I was there, so let's see. We haven't raised them since 2004, so they haven't gone up, and we've been absorbing those costs because we heard from the community that they were very costly. We did have a little bit of an increase in the application fee, but that's application for certification to sit for the exams. I will mention, as I did earlier, I alluded to, that we do have contracts with certain states, and sometimes people can come in and sit directly and do that. That's an option we can discuss. But it is more costly to do adaptive test. If you're going to have security and year-round testing where people can get exam results right away in real time, and have these much larger item banks, each individual item is calibrated, not the form of the exam. It's a much more costly endeavor. So thank you very much for the opportunity to respond on the cost of the exams.
Thank you, Dr. Cook. Mr. McKenzie.
Thank you, and thank you, Chairman Salas, and welcome. Congratulations on your new role. Just very briefly, the curriculum issue is really not an issue. California Acupuncture Board retains the authority to establish whatever curriculum they so choose, whatever number of hours, and as an accreditor, we have to verify that schools are compliant not only with federal law and with our policies and procedures, but also with state law. So it's going to be built into the process. It's an operational issue. It's not really a question of whether it's going to happen or not. So at that, I'll just, unless you have any questions for
No, I don't. Does anybody on that? Very good. Well, thank you very much for being here today and testifying on that. And I think that will conclude the Acupuncture Board for the day. Thank you very much, and thanks for the great work you're doing with the new board. It's really, now I'd like to bring forward the Board of Pharmacy. Amy Gutierrez, Board President, Virginia Herald, Executive Officer, and Ann Sodergren, Assistant Executive Officer. Is today actually your birthday? Is today actually your birthday?
So we're celebrating it today, but it was actually over the weekend.
Oh, well, that's what you were partying yesterday.
Yeah. So.
Good afternoon.
Good afternoon.
Nice to see everyone again.
Good to see you.
Sorry it's been a long day so far.
Let's
make it short.
I think we probably will in this case.
Good afternoon.
Please, thank you.
Chairman Hill, Chairman Salas, members of the Joint Committee. I'm the president of the State Board of Pharmacy, and I represent the 11 other professional and public members that make up the focus team that develop the strategic direction for pharmacy practice in our state and provide our executive officer and staff with oversight. The Board of Pharmacy is an active consumer protection agency that regulates the pharmacy profession. We regulate all who dispense, transport, and distribute compound sterile products within a pharmacy. We regulate and promote the evolving practice of pharmacy, including those recently enhanced by Senate Bill 493. The board composition is 13 members, 7 pharmacists, and 6 public members. The Senate Rules and Committee and the Speaker of the Assembly each appoint one public member. The other 11 members, 4 public and 7 professional, are appointed by the governor. Currently, the board has 12 appointed members, with 1 public member vacancy awaiting an appointment from the Speaker of the Assembly. Pharmacists practice in a wide variety of practice settings. Retail pharmacies, I'm sure we're all aware, and we see pharmacists when we go pick up medications and prescriptions. Pharmacists administer vaccines, and they're a very vital health point of contact. There's hospital pharmacists that provide 24/7 pharmaceutical care for urgent hospitalized patients and emergency room patients. There's nuclear medicine pharmacies that prepare radioactive isotopes. There's sterile compounding pharmacies that prepare critical meds that are injected into the vein, the central nervous system, and also instilled into the eye. Some of these products are produced from products that are not sterile. They have to be sterilized as part of the process, and they have to be done in a manner that's not going to cause an infection to the patient as a result of medication administration. Pharmacists manage medication therapy in hospitals and institutional settings through collaborative practice agreements. So they adjust doses of therapy and maintain medications for patients. Pharmaceutical care is critical to the health and safety of all Californians, as medication is usually the most effective and efficient way to treat and cure disease. From vaccines, antibiotics, hypertension therapy, and cancer therapies, safe medication therapy plays a pivotal role in curing disease. The pharmacist is the professional that manages this critical therapy and ensures that the patient receives the right drug, the right dose with the right instructions, along with the person-to-person counseling that is very important to keep our patients engaged as partners in their therapy. We understand that the right drug, right dose, and right instructions mean little if the consumer that's receiving that prescription drug does not understand how to take the medication appropriately to achieve the best outcome. The statutory mandate about the board is consumer protection and ensuring that each one of us as consumers receives appropriate care. As outlined in the Sunset Report, the board has just over 100 employees with an annual budget of over $20 million, 23 licensing programs. We license 140,000 licensees, which includes over 47,000 pharmacists, 7,100 pharmacies, 1,000 sterile compounding permits, and 74,000 pharmacy technicians. Other license types include drug wholesalers, which ship drugs into the state as well as within the state, and also clinic permits. We receive approximately 20,000 applications a year and regulate both in-state and non-resident businesses that provide and ship medications into California. Over the last years, the board has developed and implemented a number of policies and regulations that are focused on ensuring optimal medication quality and safety to the patients of California. And there are ongoing processes for monitoring the pharmaceutical services that are provided by professionals licensed by the board. I'm just going to highlight some of the examples and the board's impact on the lives of Californians since the last Sunset Review. Sterile compounding. You may recall what happened nationally as a public health emergency in 2012, which was announced by the CDC as a result of their investigation of a multi-state outbreak of fungal infections, which were found to have originated from a sterile compounding pharmacy in Massachusetts. That pharmacy had sold the tainted steroid compound to a variety of states. To date, there have been 64 deaths and hundreds of individuals that have been infected with meningitis, spinal and joint infections, and those that still live continuing to receive treatment for these infections. And now it's 3 years ago, and they're still receiving these therapies. The states worst hit in the US were Michigan, Tennessee, and Indiana. While there were no deaths or infections reported in California, we were fortunate. The State Board of Pharmacy took immediate action, and we increased inspections of pharmacies through the state and that prepared sterile compounded drug. As a result of Senate Bill 294, Emerson, annual sterile compounding inspections of all pharmacies are taking place, including inspections of out-of-state pharmacies that ship sterile compounds into California. So we actually do have inspectors traveling there and inspecting these locations. Another example, prescription labels. In an effort to increase patient engagement and care and improve the ability of customers with limited English proficiency to read and understand their prescription labels, the board worked with Assemblymember Tang with AB 1073 in 2015, which supported translated directions for use in 5 languages for standardized directions for all licensed pharmacies. This supplements the availability of the oral translation for consumers that was developed as part of the initial rulemaking for patient-centered labels in 2010. The board standards for patient-centered labels have been recognized by 3 national organizations as standards throughout the United States for prescription label design. We're in the midst of an opioid epidemic. The White House Summit on Opioid Epidemic, prescription drugs are involved in half of all poisoning deaths, and drug poisoning deaths have now surpassed national deaths on gunshot wounds or motor vehicle crashes. So more people are dying from drug poisoning than motor vehicle accidents. The board has developed a multi-pronged approach to combat the prescription drug abuse epidemic, which includes consumer and licensee education, aggressive enforcement of the board's licensees that elect to divert drugs or dispense controlled drugs for profit. In 2013, the board designated a precedential decision in a case involving a pharmacist who did not exercise appropriate corresponding responsibility. That's posted on the board's website. Acknowledging that there's a readily available antidote for opioid overdose, the board in 2015 also created a state protocol pursuant to Assembly Bill 1535, Bloom 2014, for pharmacists to dispense an antidote for opioid overdose naloxone without a prescription. And this can be dispensed or furnished to a patient or a family member who elects to have naloxone without a prescription. Adopted first as an emergency regulation in April 2015, the final permanent version is now in use throughout the state, and there are pharmacies that are dispensing it now. In 2012, the state medical and pharmacy boards, along with the DEA, held a 2-day summit on appropriate prescribing and dispensing to educate providers and pharmacists about the growing opioid epidemic. The board has been instrumental in educating and promoting the use of the state's prescription drug monitoring program, CURES, to all licensees. Currently, over 50% of the board's licensed pharmacists are enrolled in CURES, with our goal to have that number at 100% by July 2016, so that pharmacists can actually assess prescription history and look for patients that are drug shopping or physician shopping before the medication is dispensed. Senate Bill 493 was signed by the governor. Pharmacists were provided the ability to extend patient care options in California. Implementation of SB 493 allows pharmacists through statewide protocols to provide smoking cessation agents, vaccinations, self-administered hormonal contraception, and medications for those that travel outside of the United States. Additionally, the board has developed the framework to license the nation's first advanced practice pharmacist, which is focused on increasing access to medication management services to consumers across the state. California is a pioneer in this field, and we are setting the stage for expanding these services to other pharmacists in other states that are looking at what we're doing and planning to follow. In 2015, September 2015, you may recall that the governor announced a state of emergency due to wildfires, and the board developed emergent consumer-focused actions to promote access to those that were taking critical medications but didn't have access to their prescription or to their medication vial. We had an emergency meeting, and within 2 days, we had issued emergency regulations and promulgated them and sent them out to all pharmacies, letting them know that these patients had access to medication, even though they didn't have the prescription with them if they were involved in the wildfire. The Board of Pharmacy strongly believes in the role of the pharmacist in patient consultation. Ensuring that each consumer clearly understands the directions for use is pivotal to improving our health care. You can give someone the right medication, but if they don't take it right, it's not going to impact their health. We want them to understand. So starting in 2007, the board collaborated with 3 county district attorneys' offices in pursuing pharmacy counseling violations, and these county district attorneys' offices have collected fines from 3 of the chain drugstores for violations of California's unfair business practices statute for failing to provide patients with consultation when required by state law. The board is nationally recognized as a leader The board's executive officer has testified before Congress regarding price gouging of hospital pharmaceutical sales by secondary wholesalers. She's also represented California at a 2015 CDC International Conference on Emerging Infectious Diseases and presented on medication contamination and counterfeiting. She was elected to serve on a Pew Charitable Trust Blue Ribbon Committee to develop best practices for sterile compounding pharmacies and outsourcing facilities, and this recognized California's national leadership and prominence in this area. She's presented at 3 FDA 50-state meetings on sterile compounding and regulation of drug wholesalers and third-party logistic providers, communicating our state's proactive actions towards consumer protection in all these arenas. We've been asked to develop guidance on the end-of-life options now that the governor has signed this bill into law, and we're actively working with the medical board and with the department on identifying options and guidance for pharmacists so that this can actually be rolled out throughout the state. We're also in the process of promulgating regulations on pharmaceutical take-back, so those have actually now out for public comment, and we have meetings in April that will be public hearings to hear feedback on the draft regulations that have actually been already released. I'm proud of being a pharmacist within our great state and truly believe that the pharmacist's role is pivotal to attaining good health outcomes. In my 32 years of pharmacy practice, I can't recall a more exciting time for our profession, as the ability to provide direct health impact to consumers has never been greater. I'm also proud of leading a state board that is focused not only on public protection, but also on the promotion of health outcome through the active development of policy, education, and regulations for the public we serve. There have been several questions that have been asked by, in response to our sunset review today, and I will we'll go over some of those, and I've got Ginny Harold, who is our executive officer, and Ann Sodergren, here as well from the board to help with these responses. So the first one is regarding what improvements still need to be made. We need to secure enactment of some of the multiple regulations that are at varying stages of completion. We acknowledge that. One of the things that I'm relatively new to the board, I've been here for a couple of years, but I didn't realize before taking on this role how long it takes to get regulations through, all the multiple steps that are involved, and something new to me as a pharmacist. We need to secure a fee to increase current level of operations, and I think that's in the sunset report as well. Address issues involving the licensing of automated dispensing cabinets and machines to provide medication. We are, to require a patient to have to go back to a pharmacy to continually pick up medications, we need to increase access options. We have a pilot ongoing in San Diego for a medication dispensing device that will release patient prescriptions that are already filled and complete to patients, so it'll give them other options as well. But we need to look at ways of licensing these machines so that the board staff and the board is aware of where they're located. We want to improve communication with board licensees on changes in law, the responsibilities of a pharmacist in charge, and evolving board policies. Two tactics that we're undertaking is performing more routine unannounced inspections more frequently rather than the inspections being for cause. We also are going to be looking at supervising inspectors, contacting licensees to obtain feedback regarding routine inspections so that the board actually gets responses back and gets input from the licensees on how we're doing. Ginny's going to cover the fund condition.
Okay. Well, I've been asked to explain a little bit about, is the board appropriately directing staff resources to meet its mandates and its needs? Well, the answer to that is that enforcement is at the very core of what we do, and that's where we spend the bulk of our money. Right now, we're spending 57% of our budget overall on enforcement-related expenses, which includes, out of a $20 million budget, $3 million for prosecutions at the AG's office. Keep in mind that pharmacies, unlike a medical practitioner that sees one patient at a time, pharmacies have the ability to affect large groups of people at the same time through what they do. The staffing of the board also reflects our focus on enforcement, where we have 62% of our staff doing enforcement duties, 24% doing licensing, and the remaining 14% doing admin-related things. Is the board's program going beyond what fees can cover? Regrettably, yes. Our fees are no longer commensurate to keep us in a solvent position, and that if we continue at our current rates of expenditure, by July 2018, without a fee increase, we will have a problem. Our fund condition at the end of this year was 5 months at the end of, last year was 5 months at the end of June. This year, we're looking at 3 months at, and then another year from now, we're sitting around 1%, and then after that, we go deficit. So we have a little time, but we desperately need a fee increase, and that is part of another proposal. Did the board properly evaluate licensing fees for new categories like sterile compounding facilities located in other states that provide drug products to us? The board at the time the bill was going through took a conservative approach, and we used it based on what we were currently using to inspect then what were the sterile compounding provisions that we'd had in place since 2003 when we had a sterile compounding problem in California. But it was not enough, and we're finding that the inspectors are spending more time in facilities, particularly in large facilities out of state, which generate a lot of the medication that's being shipped in. What efforts is the board taking beyond a fee increase to mandate a healthy fund condition? Well, we have limited options in this area because we already make use of various forms of technology to do what we do. We have 20 systems that we've developed over the years to track various things so that we can be on top of things. We don't have a lot of staff for all of our applications and all of our licensees, so we try to manage that way. And then finally, we also are making better use of telephone and webinars to deal with our statewide staff. We have 46 inspectors and their supervisors who work from home offices that are scattered throughout the state. It's efficient in that we don't have them reporting to an office every day and then traveling out into the field. It's inefficient when you try to get them all together. So we are doing more use of just simple things like telephones and webinars. We have a weekly supervising inspector meeting now that we have 8 supervising inspectors to make sure that they're working collectively together and with the managers, and that we can bring in what the board has told us during board meetings or through telephone calls or sitting in sunset review committees about what you need to do in order to direct staff better. So those are some of the efficiencies we've done. So, and that's really what I have right now.
So with respect to licensing backlogs, the board does not believe that it does have a licensing backlog currently, but regrettably we did in 2014 and through 2015. The board's current processing time for all of our high volume licensing categories is at or below 31 days from the receipt of the application to the initial review. Further, the board's current processing time for deficient items is running about 35 days or less, again, depending on the licensing category. The board believes that we do now have acceptable processing times, and we will continue to focus our efforts there and work to maintain and or further reduce them. The board recognizes that its important role in allowing both individuals and businesses to enter the marketplace, and a delay on our part has a negative impact both on those individuals as well as the public. The board's expectation is to process applications within 30 days of receipt, and we will continue to focus there. We are also trying some different models in terms of how we are going to further improve our services to our applicants. Because of surges in workloads that occur because of like large corporate chain buyouts and things like that, previously, historically, that has become the focus and staff are redirected to assist there. We are trying a new strategy and dedicating resource to focus specifically in response to those corporate buyouts, as well as also working with applicants that submit deficient applications. Sometimes the applications have a tendency to languish, so the person is focusing there, doing outreach to the applicants to see what we can do to help facilitate getting the application deficiencies remedied and so that a license can be issued. The board has also initiated a modest campaign, educational campaign, to assist our applicants in understanding what the requirements are and the application process. Currently, our staff focus in 3 primary areas with respect to our licensing functions: processing applications, processing deficiencies, and responding to status inquiries. If we take care of the education up front, we're going to reduce the number of deficient applications that come in. That means that the staff that are currently focusing on the deficient items are going to be able to really focus on just processing the applications at the front end and getting people licensed more quickly. One specific question that was asked was whether or not the board has directed too many resources to enforcement. And as Ms. Harold indicated, enforcement is our core. Enforcement staffing is dependent on enforcement cases managed by the board. Thus, the staff related to enforcement functions is really commensurate with the need. By law, the board issues licenses to a site and not a corporation, and so one of the other areas that we are focusing on is the board has the ability to use a headquarter system for large chain stores, and with that headquarter system, it facilitates more easily the renewals and the application process for those individuals because that information is centrally stored in our system. We are coming up with a master file that will be used on a smaller basis for those people that do not have as many businesses, 75 or more, that can use this master file so they can, again, centrally store the common ownership things, and that should also remove some impediments to becoming licensed more quickly.